Hello, everyone. I'm Megan Scott, and today I'm going to be presenting my book report on I Shall Not Hate, a Gaza Doctor's Journey on the Road to Peace and Human Dignity by Zeldin Abuelish. This memoir is a powerful reflection of loss, resilience, and the choice to pursue peace in the face of unimaginable tragedy. I chose this book because it speaks to my heart of what nursing is about, compassion in the face of suffering. Dr. Abuelish's story aligns with the values I want to carry into my own nursing practice, which are dignity, empathy, and advocacy. Just a little background on Dr. Abuelish. He's a Palestinian physician who trained in Israel, Egypt, and London, specializing in obstetrics and gynecology. He became internationally known after losing 3 daughters and a niece to an Israeli shelling in 2009. Despite this, he chose not to seek revenge. Instead, he became a global advocate for peace, founding the Daughters for Life Foundation and sharing his story to promote understanding. His philosophy challenges us to think about what it means to heal, not just physically, but emotionally and politically. First, we're going to talk about the vulnerable population. The group specifically would be Palestinian civilians in Gaza, specifically women and children, living under military occupation and repeated conflicts. The challenges, obviously, poverty, housing displacement, trauma, limited access to physiological and physical health care. Frequent bombings, border closures, and lack of autonomy are all issues of political instability. There's obviously high unemployment, food insecurity, and poor infrastructure. Often the hospitals lack supplies, specialists, and access to outside care. If we're talking about psychosocial trauma, obviously PTSD and everyone living in this area that's vulnerable to these attacks, specifically the children, and loss from parents, everybody involved in these like unspeakable acts. They aren't just statistics, they're lived in realities that shape every aspect of care in this region. These are some images I wanted to include because they're deeply impactful to me. They remind me that the crisis is real and it's happening right now. Behind every destroyed home is a family that just lost everything, and parents here in an unbelievable position just trying to protect their children. Obviously, as a mom to my own girls, these pictures and what we're seeing in the news absolutely breaks me every time I see it. From a healthcare perspective, every act of violence creates a ripple effect that as nurses, doctors, and caregivers, we're left to pick up the pieces and help these people. To me, that's just a call to action. Okay, so some health disparities. We talked about it. Shortages of medical specialists and supplies, high maternal and child mortality rates, limited access to healthcare, and mental health crisis. Gaza's healthcare system is severely strained. Hospitals are lacking electricity, clean water, and basic supplies. Patients needing advanced care like cancer treatment or surgery must apply for permits to leave Gaza, and those permits are more than frequently denied or delayed. Mental health is a silent crisis in Gaza. Children grow up witnessing bombings, loss, displacement, PTSD, depression, and anxiety, but there aren't really any resources for these kids. Mental health services are scarce. I mean, they can barely afford hospitals to treat, life-threatening injuries, so mental health is kind of on the back burner. Dr. Abuelish's daughters were killed in an airstrike while they were inside their home. This illustrated how tragedy affects civilians, especially children, and they're essentially caught in the crossfire and denied safety. According to the World Health Organization, fewer than half of Gaza's hospitals and under 38% of primary healthcare centers are even partially functional. Bed occupancy is a major problem in Gaza. Shifa Hospital is at 250%. And Al-Ahli is at 300%. Over half of essential medications and nearly 70% of medical consumables are completely out of stock. This can mean antibiotics, pain medication, gauze, basic treatment supplies that these people just don't have. These conditions specifically violate WHO's own benchmarks for emergency health infrastructure and access to care. As it applies to nursing, this book reminded me that healing begins with dignity. Where I work in the ER, I've seen how small gestures like offering a sandwich tray to somebody can open up conversations about deeper needs. His story reinforces the importance of trauma-informed care, especially for patients who experience loss, displacement, or systemic neglect. We have to be able to offer these people resources and not just, a packet of papers with phone numbers. We need on-ground support to get people help that they need. We could do something like mental health screenings during routine visits, peer support groups for grief and trauma, partnerships with local food banks to address food insecurity, clear discharge education, especially for patients with low health literacy. Oftentimes I'll see when somebody's discharging a patient, they'll just hand them their discharge papers. But we need to break down that language and make it very clear and offer instructions or even demonstrations so that people understand what we're saying. I've noticed that cultural sensitivity is something I've been, for lack of a better word, disappointed with in this area. I've been fortunate enough to travel the country when I was in the military, and I've been in a lot of different places with a lot of different people. And the resistance to cultural understanding here is somewhat striking. Since 9/11, as a country, we've been really hesitant to be welcoming or nice to Muslim women or women wearing hijab. And, the looks that people get when we see people like this is kind of disappointing. And I still see that today. Even, working in the hospital, sometimes nurses won't want to treat Muslim people because in their head they tie them to 9/11, and, that's sad. Implications for new nurses. We need to build empathy and emotional resilience, encouraging, again, that trauma-informed care in a patient-centered environment, and highlight global health disparities and advocacy. I think this book is really a hallmark for new nurses. I think everyone should read it, but it's a masterclass in compassion. This guy lost his whole family essentially, and he's teaching us that healing isn't just clinical, it's emotional, ethical, and it's human. New nurses often feel overwhelmed by tasks and protocols, and this book reminds us to slow down and see the person beyond the diagnosis. To me, it introduced trauma-informed care through lived experience. It expands our worldview, showing how political conflict, poverty, and grief shape health outcomes far beyond the hospital walls. This message directly aligns with Healthy People 2030, which prioritizes eliminating health disparities and achieving health equity. Also, something that we're familiar with, the ANA Code of Ethics, especially Provision 8, reinforces this responsibility. It calls nurses to advocate to protect human rights and reduce health disparities. That means advocating for vulnerable populations, listening deeply, and practicing with compassion, even when it's uncomfortable. Implications for veteran nurses. Hopefully this would reinvigorate empathy and purpose and encourages reflection on global health and moral courage. And as always aligns with ANA Code of Ethics and lifelong advocacy and human dignity. The story reminds you that nursing is not just about clinical skill, it's about moral courage. Many experienced nurses face burnout, compassion fatigue, and disillusionment. This book recenters empathy. It shows that even in the face of unimaginable loss, healing is possible, and that nurses play a vital role in that process. Veteran nurses with their experience and influences are uniquely positioned to mentor younger colleagues. And I feel like this is really important. Advocate for systemic change and bring trauma-informed care into leadership and policy. a lot of these veteran nurses are in leadership positions, or they're a charge nurse or a department manager. And things like this are really important for us new grads to know. Some of the things I was surprised about was, obviously the most surprised was just the way this man continued to help people and overcome essentially the awful thing that happened to him that, would lead a lot of people to just give up. Things I Googled, Gaza War, 2008 to 2009, Jabalia refugee camp, which is where he grew up, and then the Harvard public health program that he participated in. I explored a lot of trauma recovery, the psychology of forgiveness, global health systems, and healthcare in conflict zones. Some of my golden nuggets. Healing is stronger than hatred. Forgiveness can be a form of resistance, and the power of one voice to challenge systems of violence. Reading this book, I felt like powerful sadness, not just for his loss, but for the countless families living in conflict zones who never get to tell their stories. And I think the hardest part of reading this is that it's going on now. We see in the news everything going on, and it's hard to see, but I think it's important that we see because we need to be informed. And I felt a lot of admiration. The power of his emotional resilience and his ability to keep practicing medicine and keep advocating was super humbling for me. It reminded me that trauma-informed care isn't just a framework, it's a mindset and a practice. So it's something that we have to continue building on. By the end of the book, I felt more committed to advocacy, not just in theory, but in practice. It's those little things, like I said, walking someone through discharge papers or offering food to someone who hasn't eaten. I want my care to reflect dignity and empathy, even when systems fall short, which we see frequently, unfortunately. So this is summarizing what I kind of just talked about. I felt a renewed commitment to advocacy and trauma-informed care. I'm new into the nursing world, so I'm still developing habits and figuring out what works and what doesn't. And this book kind of made me realize that even though, in an ER, wherever we work, we see a high volume of patients very quickly. And I think that sometimes we can use that as an excuse, but I don't want to do that. I want to care about each patient, and I want to make a difference and just feel like we're contributing to a greater good. Some of the questions I had after reading this, obviously Dr. Avalish is, one incredible man, but in terms of healthcare as a system, can we truly be apolitical? Which is something that we're seeing in the news now with these, I don't know if you've seen, but massive amounts of aid are traveling to Gaza in ships and but as a system, are we able to kind of cross boundaries like that? And what is the gray area? He's working in Israeli hospitals while living in Gaza. And his commitment to treating all patients equally, regardless of nationality or politics, was powerful. And I think that that's something we need to evaluate as new nurses. What systems can support healing when justice is absent? In Gaza, families lose loved ones without accountability. To relate that to our community in Denison, patients face poverty and neglect without real change. So they're coming into the hospital and they're hungry or they're displaced, and we essentially treat them for any kind of medical diagnosis and then we send them on their way. So what do we do? How do we keep doing that without changing the system? And then how do we teach forgiveness and trauma-informed care? Forgiveness can be transformative, but it's deeply personal. So to me, in nursing, we obviously support, physical healing, but we don't always know how to help patients navigate moral and emotional wounds. So that's something to maybe explore, is how we keep it respectful and professional, but at least give patients an outlet.